Okay, so I'm with two doctors here who are first timers in my teaching, and they are both planning to appear about 6 months from now, 5 or 6 months from now. One of them, Dr. Bilal, is working as a middle grade clinical fellow in Scotland, while the second doctor, Dr. Tasneem, is working as a uh, PICU doctor in Bangladesh. Have I got both of you correct?
Yes.
Yes, sir.
Okay. So both of them have joined my session first time, but they are also actually very new at MRCPCH studies. So kudos to them for having the courage to join and to participate today. So I'm just going to go through a general kind of framework for communication stations today. So the most important part in the communication is not the actual communication, but is the preparation in the first 2 minutes. These 2 minutes will decide whether you will clear or you will not clear the communication, because there are three things you have to remember. The first is to read the scenario very carefully and to remember what is the task. Now, I mean, if you just think, oh, this is a task about VSD and you start drawing your VSD and all that, you may or may not pass because the task may be specific within that. Okay. In a similar way, when Dr. Bilal, you asked to talk about the bone marrow procedure, you would have been well advised to actually draw something there and to show how the bone marrow biopsy is carried out, because the question was about the procedure and not about the diagnosis. Correct. So the focus of the this thing, what you call the whole examination, the focus remains on what is your task. And if you sometimes say, for example, you forget the name of the parent or you forget the name of the child, it's okay as long as you remember what is the focus of your task. Ideally, you should not, of course. You should have written everything down. And when you start the communication and you start greeting the parties over there, you obviously need to ask Dr. Tasneem, which I don't know whether you did or not, how may I call you? Okay, so they might say, please call me Tom, and please call me Peter, or please call me Rebecca, or whatever it is. So remember that they have the right to be addressed in the way they want to. That is the first thing. Okay. The second thing is, when you are sitting before two people in the communication scenario, lean forward and talk to both of them one by one. Don't just keep talking to one person and ignore the other person. That's more relevant for your scenario, Dr. Tasneem, because there were two people there, the father and the mother. In your case, Dr. Bilal, it was only a 16-year-old girl, so you have to be a little careful. You might want to ask her whether she would like anybody else to be present, okay, for the communication. You just can't straight away go into the room and talk to a 16-year-old. So ask if she would like somebody else to be present, and she might say that, no, I'm all right. You can talk to me alone. Then you've got the license to carry on communicating with them alone. But otherwise, if you're talking to just a young girl, definitely it is useful to seek permission to talk to them alone and ask if they would like anybody else to be present. In the same way, in most scenarios, you'd be advised to sort of ask them, do you want anybody else to be present? Is it convenient for me to talk to you now? Would you like to talk to me later? Are you all right? Something like that. If you're breaking bad news, like the VSD scenario that you had, Dr. Tasneem, it might be a good idea to sort of offer something like, in addition to sympathy, uh, would you like a glass of water, or would you like to if they're crying or emotionally disturbed, then maybe offer tissues. So it's like a human interaction. It's not just doctor to patient or doctor to relative. There should be a humane element to it. And the examiner will appreciate if you show that during your communication. Remember, in every communication scenario, one of the things to remember is that you may or may not have the time to complete the communication. Sometimes the scenarios are very complicated, and you can't explain everything in 7 minutes or 9 minutes, but you can say that, I know it's a lot for you, and I think that it might be useful if we came back for another session. Is that okay for you? So offer to do a follow-up communication if the matter is not completely explained. So I felt that in Dr. Bilal's case, the scenario did not get actually completed because they did not draw anything, they did not explain anything about the side effects, complications, blah, 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 blah. So it is quite useful sometimes to say, and you don't have to say, we'll put the needle here or needle there. Say that the actual procedure will be explained to you by the team that
Okay.
does the procedure. But it is my job to give you just an overview, okay? Like a bird's eye view of what the procedure is going to be. So do not go into the nitty-gritties. And yeah, so that was that. Then the last bit, so when you're closing, I think before we go to closing, there is also something called understanding. So I think Dr. Bilal, you were a little more in that area because you worked in the UK. Dr. Tasneem, you kept on giving information, but you did not check the understanding. So keep checking the understanding every 30 seconds, okay? So after you give one or two bits of information, say, are you with me? Or do you follow me? Or is there anything you want to ask? Okay? Or can you repeat back what I have told you? Towards the end, you can ask that also. So that you know that whatever you have told to them, they have understood properly and they have communicated back to you that this is what they have understood. Okay? Uh, so then we come to the final bit. So the final bit, obviously, you have. I don't, Dr. Bilal. Did you offer leaflets or anything like that?
No, I didn't. Sorry.
Yeah,
I
nor
offered.
did you, and nor did Dr. Tasneem. So always
Yeah.
offer some information that they can digest later
Yes.
on. Okay,
Makes sense.
so
Yes.
so say that the best website for most of the common procedures is nhs.uk, and that's a website that is available for anybody in the UK without any password. So they can look up that particular thing. Let me show you that website so that you know what it is. Let me share it with you. Oh, I think my keyboard is not working. I'm really sorry. There's some problem. After I restart my computer, maybe it will work, but I will share it later on. But it's simple. It's nhs.uk. If you open it in your mobile phone, you'll be able to see what it is. It should be
Fine.
quite easy to access. And there is something there called diseases A to Z. So the first thing you do, you open and you can share if you want on your Zoom. I will allow you to share if you want to share something. Dr. Bilal, can you open on your device where you are right now?
So, did you say nhs.com?
No, nhs.uk.
nhs.uk.
Mhm.
Yes.
Okay, can you share what you see on the device with us?
Uh,
So you can see the share button at the bottom.
so actually, my phone is not that great. So yeah.
There is three dot in the left lower corner. So there it may be.
If it opens on your phone, Dr. Tasneem, you are free to do that.
The site is NH.
nhs.uk.
Okay, sir. Yes, let me check. So this one.
Exactly. So 1 minute, not hook. Go down, go down. No, no. I think maybe that
Let me see
there,
that.
this
This
one.
one. This one.
Let me
NHS
this one.
website for
Yeah. So
England.
if you open this,
Hmm.
now you can see. So accept the cookies first. Accept the cookies. Okay, now
Yes,
go
sir.
to health A to Z. Then go to conditions A to Z. or tests and treatments A to Z. So go to tests and treatments and then go to B for bone marrow.
It,
So it may be there, it may not be there. Okay,
Yeah,
biopsy may be
biopsy.
not there. Just go to
Yeah, there
biopsy.
is. Yeah, it's the second one. Yes.
So this is like how it is. So patients are given this link and they can see what all things happen. Okay,
Um,
everything is not there obviously because it's a website, but sometimes they can just do a normal search for bone marrow biopsy or bone marrow aspiration. But common things are there. If you go back to the back arrow, tests and treatments, select again, go back one step. Now select L for lumbar puncture in the same tests and treatments. No, tests and treatments.
this one. Okay, so
Yeah,
Western
go back
treatment.
down. Yes, this one. And then select L for lumbar puncture. Yeah, you got something lumbar. Yeah, there you go. So you can click on lumbar puncture. So like this, for example, before doing a lumbar puncture, when you are ready to take consent, this is how you refer to them and say that I'll be back in about 10 minutes, but why don't you read about the lumbar puncture and understand how it is done. So you can say that this is usually done, this procedure in this website is mainly for adults, but it is similar to what we do in children. So if you go down, keep going down, keep scrolling down. You
This
can see
one.
this is an adult patient, okay?
Yes, sir.
But it's a simple kind of thing where you can explain to the parent about this. So this is in real life, not during MRCPCH exam. In the exam, you'll have to draw this, okay? Or you'll have to explain like with the help of your hands that this is how the child is kept and this is how how we do it and so on and so forth. So you can stop the share now. But I hope you understood what this is all about. So yeah, you can close it, stop share, go to the bottom and stop the share. Excellent. So no, no, yeah, there you go. So this is important. The last 2 minutes. So basically, initially introduce yourself. Before you introduce yourself, you have to give the mark sheet to the examiner and say that I am Dr. Tasneem and this is my mark sheet. Then you don't need to wash your hands for communication scenarios, but you can apply a what do you call it, a disinfectant if you like, because you are in a kind of an environment which can have infection around itself. So you can clean your hands with a sanitizer and don't offer to shake hands or anything like that. Keep a professional distance from the patient. Greet them properly, explain who you are, introduce yourself, introduce exactly how the scenario says. So don't say I'm one of the doctors. If the scenario says you're a specialist pediatric registrar, then say I'm a specialist pediatric registrar. If the scenario says I'm a neonatal registrar, say I'm a neonatal registrar. If the scenario says you're a clinical fellow, say you're a clinical fellow. So introduce yourself in the exact words of the scenario. Okay. Then you obviously say, would you like anybody else to be present? Are you okay or comfortable? Would you like a glass of water? Blah, 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 blah. If they're standing, then say, can you please sit down? Take a seat. Okay. And communication should be open and as far as possible, open questions should be asked, not closed. So initially start with open questions and then you go to closed questions. So open question would be, what are your concerns? Closed question would be sometime in the end that, have you understood everything I've said about bone marrow biopsy? Or do you have any more questions? So that's a closed question. Okay. But still maintain the dignity and the respect of the parent and the patient, and slow and careful measured voice should be always used. Don't try to rush everything because you want to finish the communication in 9 minutes. Okay. You can always break up the communication and say that I'm afraid we don't have time for more, but if you wish I can arrange for another appointment with you so that I can complete the communication. Is that all right? Yeah.
yes. Yes.
Okay,
Thank
sir.
you.
So then towards the end, obviously you offer, and during the whole process, keep on checking their understanding. If, for example, they say, oh, no, I didn't understand anything, can you repeat yourself? Please repeat whatever they have asked you to repeat because the consumer is king. Yeah. So if they have more questions, don't need to complete your scenario. Go back to whatever they want to ask you and spend more time there. All right. And then say that I'm afraid, I'm sorry, I could not address your main concern, but I need to go now. And if you want, I can come back to you and continue this conversation later. If it is something where the parent is not trusting you because you are a junior doctor, then say that if you wish, I can bring my consultant the next time and you can ask them the questions. So offer to join with the consultant the next time. Okay. Or say that I'll get my senior colleague, or I'll get my senior registrar, or I'll get the specialty doctor, or I'll get the something, whatever the relevance is. Okay. If the question is about some administration of antibiotic that's not given in the right dose, or somebody is given a very high dose of gentamicin or a very high dose of insulin, child is all right, but they are obviously very upset, and they want that you name that person who was given the injection. So I said we can't name the person, the hospital policy doesn't allow us to do that, but we will make sure that whatever you tell us, the feedback will be given to them, and the hospital has a very robust policy to discuss this and to have give the feedback to the person who has done it, so that they learn from it, and the process is then put in our trust policies so that the same mistake doesn't happen again. So that kind of thing. So do not put anyone in a spot. Don't say that, oh, I don't know about echocardiogram, I can't do it, so I don't know why they missed it. Okay, in the antenatal scan. That's not your job. You represent the face of the NHS. So do not blame anyone. Do not say they are the people who did the wrong thing, not us. No. Okay. Be a part of the team. Okay. And make sure that you are the face of the hospital. We don't want them to go to the complaints procedure. We want them to understand us, and we want them to realize that we are here to protect the patient at all costs, not to punish the person who has done the thing. Okay. So this is, I think, my summary, general summary from today's talk. Okay. So I hope you found that useful.
Yes,